These arteries are a muscle, not a pipe. They expand and contract. They do their job. And so the intention is that inside the artery wall, it's got this endothelium, this lining of the skin. We'll just keep it simple. And if you put your thumb and finger together, that's what the inside of the looks like. It's all skin. Well, that skin gets damaged, particles get through, builds up. Artery disease builds up inside that lining of the artery wall. There's no such thing as cholesterol building up inside an artery. So it's always building up inside the lining of the skin, like a pimple on our face.
Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun, so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hello, this is Dr. John, back with another edition of The Balancing Point, and I've got a very interesting guest today, one that I'm really excited about. He talks about some things that I've been fascinated with for years, and that's Dr. Diamond Fernandes. Dr. Fernandes is an integrative cardiac health specialist and the founder of the HeartFit Clinic. His work is driven by a deeply personal story. His father suffered a heart attack at 38, very young, and then had bypass surgery at 42. And that actually sparked Dr. Fernandez' mission to understand how to truly prevent and reverse heart disease beyond the kind of traditional paradigm. Dr. Fernandes has clinics across major cities in Canada. He focuses on going beyond the traditional plumbing model of cholesterol and blocked pipes. He uses extensive testing, advanced cardiac rehab programs, and therapies like external counterpulsation to improve artery health, grow new vessels, and reduce the risk of plaque rupture. His books, Beating Heart Disease, and the upcoming, and I love this one, Death of the Stress Test, is challenge. He wrote them to challenge outdated approaches and highlight the roles of lifestyle, infections, autoimmunity, mindset, and emotional health in protecting what he calls the love muscle at the center of our lives. So welcome, Dr. Fernandes. It's really
Thank you.
nice to have you.
I speak a lot at conferences. I educate a lot of physicians, but I'm not a physician. So I always like to start off by talking about that. So,
Oh, that's
yeah.
fascinating.
Yeah.
Okay. That's
So I've been involved in the field of cardiac health. So as a cardiac rehab physiologist, I've done that for almost 30 years. And it's something that when I started my career, I was working with a group of cardiologists, and the intention was for me to go to med school. And I never did it because I hated the sight of blood. And that's all we do. We do that a lot in our clinics now. But it was amazing because I was in a 1,000 square foot facility with all these docs, and I got to be able to be a sponge to learn everything that you need to know from the foundations from a cardiology perspective. And so I started my career in '99 doing that part. And I all I would do doing a lot of them was stress tests, one after another. I've done, gosh, whatever, a lot of them. And that's where my book, Death of the Stress Test, came out, because I still see it today, is that people use that as a diagnostic tool and forget about the healthcare side of things. In the financial markets, they stole that term from the medical community, saying, hey, we stress test this market and that market. And so the word stress test in our healthcare system, in my opinion, has to go away. And the reason why I wrote that book, and it's out now, The Death of the Stress Test, is because the intention is because how we evaluate heart disease and to see where your heart attack or stroke risk is, people are using this outdated method to look at the artery like a plumbing model. And the arteries aren't a pipe. It's not like where, cholesterol accumulates to this pipe and you have a last cheeseburger and fries and the last piece of cholesterol attaches and all of a sudden you have a heart attack. It does not happen that way. And the idea behind understanding why that happens, we talk about all the time, I talk about all my books all the time, is that these arteries, they're a muscle, they're not a pipe. Many people think like that cholesterol analogy. And so cholesterol is not what causes heart disease. Yet, there's all these drugs to lower cholesterol. Well, if that's the case, we should see no more heart attacks. So it goes beyond cholesterol.
great point.
And the second thing is that if we know it's not a pipe and we know now it's a muscle, Like you can feel these things expand and contract. It expands and contracts. It's a muscle. And if it expands and contracts, we know it's a muscle, then using the stress test to find out if you have a plumbing problem is the wrong tool to use. I actually love the stress test because you get some valuable data from that test. What I don't love are the outcomes. Hey, you got clean pipes, continue as you are. Well, you could have a heart attack walking into the parking lot, which has happened before.
Mm.
Or you could have I've heard hundreds of cases where people have done a stress test, months later ended up with a heart attack, weeks later, months later, whatever it is. I got a clean bill of health. They told me I thought I was good. So that's outcome number one. And outcome number two is, oh, we found the plumbing problem. Let's go do more testing to see if you need a heart stent or bypass surgery. And the data shows that we don't do that either. And what if you could grow new arteries? What if you could improve the artery health so that you don't need those interventions like a heart stent or a bypass? And that's why I don't like the stress test, is because of the outcomes.
Yeah, that's a great point. You know, I think that point is really great because you're not saying it doesn't do what it's supposed to, the test. It's just it can lead in the wrong directions, right?
Correct.
Either too much or too little
It's a
of
valuable
advice after
tool,
that.
but the problem is we just use that one tool when there's so much more you could use now. Like we're in a new era now. It's not 1960, 70 anymore where we found the stress test and this is the test to use. And then we adopt that in the 80s and 90s and talk about cholesterol as a problem. And it's not. It's not. How we understand heart disease goes well beyond what we think it is.
Well, one of my kind of aha moments, that there's so many things in life that you kind of know, but then one day it's like, oh my God, of course, right? It's like,
Mhm.
I can't believe I didn't think about that. And I was reading Tom Cowan's book, um, The
Yeah.
Cosmic Heart.
Yeah.
And he said, now, do you think a pump the size of your fist can pump a semi viscous fluid through, I think he said 70,000 miles of blood vessels? And if you ask that question to a hydraulics engineer, they just laugh at you. And I was like, well, of course. But, I hadn't really put it together that way. So,
That's not a pump like we think it is.
right.
It's got a
And
pump
then
to
the
my
artery,
furthest part of my body, the big toe, stop there, exchange gases, and then return back to the heart. If anywhere I need a pump is at every ending of my body as
right.
well, if it's a
Exactly.
pump.
Yeah. And of course, the blood flows at different rates in different areas. At least that's what I've been told. I've never
Mhm.
measured it. So that's fascinating. This whole I did a class probably 20 years ago, and it was a cardiology. Uh, at that time, it was live program down in Southern California, and one of the speakers got up, and he was in his 60s, and he said, it's all about inflammation. It's all
Mhm.
about inflammation. And he put this slide he said, I'm going to show you something simple. And he put this slide on the board, and there must have been 500 things on that. So this is what happens with inflammation. He said, I presented that at the college that I was an instructor at 20 years ago, and they fired me for saying that inflammation was the problem more than cholesterol. So, it wasn't that long ago that you couldn't even question these ideas. So, and what so that's you started the HeartFit clinic because you just wanted to make a bigger difference because, with your father's illness and then seeing all these interventions that weren't really working very well. How long ago did you start the clinic, the HeartFit clinic? What really was the push, the motivation?
I think the idea why I started the clinic is more okay. So my inspiration from it, as you mentioned, I have a family history of heart disease. My father had a heart attack at a young age. When I was in my 30s and 40s, I was like, oh, okay, well, this is going to be something I have to deal with. Well, and what made me start the clinic is I was working with a group of cardiologists in Calgary, and it was in 99 to 2005, and I kept on seeing these patients come back. Right. And it's like, okay, well, they had a heart stent, they had a bypass. And I saw my dad end up with another event. And so it was like, we're doing the wrong thing to help these people. I go, people require a little bit more time and attention when they've had this, especially a heart attack or going through a stent or bypass surgery, sometimes a little trauma to it. So there's there's a whole thing that happens where I'm like, okay, people require this personalized care. So I left that clinic in 2005. I was introduced by a cardiologist in Montreal about external counterpulsation. I loved it. I loved what it does. And I'm like, okay, I went to Dubai, I opened up a clinic there, not my own, with one of the cardiologists. And then I came back. I'm like, look, I got to do this back home at my hometown in Calgary. And so I started to see the benefits for myself. I started to see patients going through the treatment, getting benefits from doing the treatment. And when I saw that, that's where I'm like, oh wow, this is this is what it's supposed to be. This is what health is. And so when I started to get deeper and deeper into it, I met a bunch of mentors along the way that it's like Diamond, like it's not cholesterol. And if it is cholesterol and we can lower cholesterol to almost zero, then why are we still seeing problems? And this is where I think it's important to have that curiosity stake and that curiosity side of things. So why I started the clinic is because I wanted to see, I wanted to be able to be the steerman to how we can help prevent and reverse heart disease. Because people, and even if you go on chat bots and this chat engine, it'll always say, make sure you seek medical help from the top of the cardiology chain. But if the top of the cardiology chain is doing it wrong, now it's not that they don't love you. It's just that their job is to make sure that if you have a heart attack or if you have heart complications, you need a pacemaker, you need a bypass surgery, a stent, you need to get on the right medications for, maybe you're on heart failure, whatever the pillar that's concerning wrong with you, they're amazing when you're having that emergency situation. But if you're trying to prevent it, whether it be another event or prevent a first event, the cardiologist is looking at the artery the wrong way. And this is why stress tests, has got to go away. We talk about calcium scores and CT angiograms as people doing that as a preventative basis. It's not the right tool. I mean, it's better than the stress test, but it's not the right tool because you're looking still at the artery like a plumbing problem. And artery disease will progress, but the intention is to lower it.
Gotcha. And, everybody, I would think, would have known for a very long time that and treated the arteries as a muscle, because anyone who's in medicine knows you do a venous blood draw. You don't do arterial unless you have to, because arterial blood draws are very difficult because the artery is so muscular,
Mhm.
right? But
Yes.
still, I still hear that the heart, and they're still teaching in a lot of schools, that the arteries are just there to carry the blood. They don't really do much of the pumping action. And so you're saying they're
Feel it.
really, yeah, I know.
Yeah. Feel them. Yeah.
Chinese medicine, we do pulses all the time, feeling
Yeah.
everything, and making diagnostic decisions based on that. So we're pretty clear about that.
And
um,
that's where, look, cardiologists, they love you, but they're not good at preventing heart attacks unless they've gone into that side of things.
right.
If they're staying in the conventional arena under generalized insurance, whatever it is, government insurance, they're going to be inside an umbrella that is guideline focused to, it's just the wrong thing. And that's why I wrote the book, is because we have to rethink how we treat artery disease. And on our website at heartfitclinic.com, you can go and get the book. It's inexpensive. It's just so you can understand the gaps in the healthcare system. Because if you're trying to prevent or reverse a disease, there's some things that are important to look at.
Gotcha. Absolutely. And so you mentioned external counter pulsation.
Mhm.
I got fascinated with that a few years ago, and there's only one center here in the San Francisco Bay Area, at least on my side of the Bay Area,
Yeah.
that does that. Can you tell us a little bit about that?
So it's a safe, painless treatment for people to improve the artery wall. So I think before I get into external counterpulsation, it's important to understand the artery wall, because we've been talking about it now, is that these arteries are a muscle, not a pipe. They expand and contract. They do their job. And so the intention is that inside the artery wall, it's got this endothelium, this lining of the skin. We'll just keep it simple. And if you put your thumb and finger together, that's what the inside of the artery looks like. It's all skin. Well, that skin gets damaged, particles get through, builds up. Artery disease builds up inside that lining of the artery wall. There's no such thing as cholesterol building up inside an artery and just flapping in the wind. It doesn't happen that way. So it's always building up inside the lining of the skin, like a pimple on our face. So with external counterpulsation, we know how artery disease happens. With external counterpulsation, we're trying to strengthen the endothelium. People are like, okay, well, how do you do that? Well, when you're increasing a massive amount of blood flow, so we're pushing blood flow. So there's these cuffs that go around your calves, thighs, and buttocks. It sequentially push blood back up to the heart when the heart is in a relaxed state. When the heart contracts, the cuffs relax. When the heart relaxes, the cuffs contract. That's the counterpulsation that's happening. So it's acting like a second heart, if that makes sense. So we're
Wow.
retrograding blood flow, we're pushing it up. So we're pushing more blood volume in the cardiac cycle, we're retrograding blood flow. So all this stuff is happening while we're pushing blood flow. Now, when we're pushing this blood flow, it's important to look at when we're starting to look at those things, the artery has to expand and contract. So with external counterpulsation, we're strengthening the endothelium, the lining of the artery wall. And think of it like if you have artery concerns or blood flow concerns or microvascular disease or whatever be the situation, think of it like a 10-lane highway system and one lane closes up every month, and that's your route to the office. By the time you get to 7, 8 lanes closed, you're going to be like, forget this congestion. I'm going to start to find a different route. You might be successful and not. And you can have all those lanes closed, all 10 lanes closed, and still that's a heart attack specifically. But you've managed to develop these collateral flows. And when you start to develop the collateral flows, that's where you start to see the benefits. And in fact, if you look at it, I think if you Google it, like if you say what percentage of people that have heart attacks are silent, meaning you didn't even know about it, the data will show anywhere between 20 and 50%.
Mm.
And let's go to the low end, 20%. That means 1 in 5 people are having a heart attack and didn't even know it. Not the whole population, but when they do have it, only 20% actually feel it. And that's how they could get away with it, because they managed to build collateral flow, or they managed to dissolve things quickly to be able to do that. Because your body, if it does it gradually, that's that's the that's a benefit, right? If it does it gradually, I can give my chance for my body to do what we call angiogenesis, which is growing new vessels. Now, the problem happens is if you close 1 or 2 or 3 lanes closed, you still have 7 lanes open, right? So still getting good flow. But what happens if a pimple pops in the artery wall? All of a sudden, all those lanes close right away. That's a heart attack. That's what gets you to the emergency room, where we want you to go to the emergency room very quickly.
Awesome. Yeah. So
Your cardiologist will excel and save your life.
got you. Exactly. And so you do a lot of functional medical stuff in your clinics, right?
Correct. Yeah.
And one of the things that I found, for example, there was an article came out sometime in the past called "Predicting Female Heart Attacks 30 Years in Advance," and they said if you look at LDL, cardiac C-reactive protein, and lipoprotein A, you can make those are predictors.
Uh-huh.
I'm 75 years old. I've never had one of my doctors run an HSCRP on me. I've never had any of my doctors run a lipoprotein A. I mean, I run them on myself, but it's fascinating that that isn't getting out to the mainstream doctors, the
You
GPs.
will now, because
Yeah,
there are
right.
medications that are coming out to treat lipoprotein A.
Yeah, that's what I've heard.
Yeah.
Yeah,
And so,
I have. Yeah.
yeah. So the only test, and this is what's upsetting about the whole thing is that they test things because there's a drug for it.
Oh, yeah.
Like, we used to walk into doctor's office, let's call it a decade ago, and be like, okay, I'm overweight, and they wouldn't even think about it twice. But now you walk in a doctor, you're overweight, and guess what? There's these GLP-1s now that everyone can take. And
Right.
the marketing campaigns are just beautiful to, hey, just ask. And so everyone's asking for these GLP-1s now, and it's like, okay, well, it wasn't a problem. It was always been a problem. Being overweight is not okay, right? And now there's these GLP-1s that can automatically fix it for you.
Right.
So overweight was always been an issue, and now there's a drug. Now everyone's measuring your weight so that we can give you that drug.
Exactly. Yeah.
Lipoprotein A has always been an issue, and now we're going to start measuring because there's going to be a drug.
Right. Yeah. Yeah, that's the way the system works, that's for sure. And in terms of inflammation, what kinds of things do you see that trigger a lot of inflammation that affects the arteries?
I mean, there are hundreds
Long
of
list?
things. Yeah, hundreds of
Yeah.
things that can hurt the lining of the artery wall. And when you talk about the fire analogy, like that's so important. And I'll say it again, is that there are hundreds of things that can cause damage to the lining of the artery wall, and cholesterol is not even one of them.
Mhm. Yeah, I remember reading a few years ago that or actually there was a doctor that was very, very great doctor down here. He had a radio show, and he said that the danger of influenza, he said very few people die of influenza, a few more die of pneumonia, but he said the heart attack risk goes up dramatically for the next 6 months because of the damage that's done to the artery wall.
Okay, so there's a few other things that happen. So I'm going to keep it simple for our listeners.
Okay.
We talk about the lining of the artery wall is all skin, right? So we know that the artery is a muscle, not a pipe. We know that. And so there's inflammation that happens to the vessel wall on the outside. So if someone hurts the skin, you ask me what they are, hundreds of things. Yes, there are hundreds of markers that you can look at. But if we're talking about markers, yes, high blood pressure, yes, diabetes, yes, poor nutrition, yes, environmental health, toxins. You can go down the list, a lot of things. And obviously poor nutrition is a big one that can damage the endothelium, right? So that's what we call inflammation. But when it gets damaged, then cholesterol comes into play. And cholesterol only comes into play with particle sizing. And so then those small guys get through the lining of the artery wall, not these large ones. And so it's important to get that particle size testing. But then when it gets through, then there's another, let's just call it a source of inflammation that happens there. It's where it affects the immune response. And so these immune cells, white blood cells get involved. All these activities start to happen inside the lining of the artery wall. And so we know, and this is just we know when you end up with any autoimmune or you start to give a vaccination that has that immune response, it can affect the immune response to the artery wall or the inflammation inside the lining of the artery wall. And so we know that can happen. And so it can disrupt a plaque or potential plaque or pimple popping inside the vessel wall. So one of the best things you can do just to keep it simple for everyone is just eat foods that can help lower that inflammatory response.
And do you have a particular anti-inflammatory diet, or do you really tailor it to the
I
people?
think it's tailored to the people, but I think one generic thing that I can say, and I wrote about it in my books, is that if anything has to advertise to you, just stay away from it. I think that's a simple rule of thumb.
That's
Yeah.
great. Um, I do a
Like
lot
if you
of
have to turn something over and look at the ingredients, and then just stay away from it.
Yeah. I do a lot of gut health work, and I was very pleased a few months ago when a study came in and said that the basic Mediterranean diet was just as effective as the almost impossible FODMAPs diet for IBS. And it's like, okay, anybody can eat Mediterranean. That's
Mhm.
great,
Yeah.
right? And so do you have a list, like the top things that you'd suggest to prevent heart disease?
I, I wrote about it in my first book,
Okay.
and I think, exercise is medicine. What you put in your mouth is medicine. So nutrition is important. I talk about relationships. The heart is the love muscle. It wants to give love. It wants to receive love. And doesn't mean that, hey, you have to be in a relationship with a partner or that you have to stay in a relationship with a partner, but you can find that love connection in community. You can find it in family. You can find it in loved ones. You can find it a lot of places in friendships. And so there's a lot of place where you can find it. So don't think about, hey, I have to find a partner of life. And not everyone is fortunate to find, and some people are fortunate to find the love of their life. And if, I was reading some studies out of the Gottman Institute that it's like when you look at partnerships, long-term partnerships, that, only it's a small percentage of people that actually get that connection that way. And, this is why divorce rates are high. And conflicts are high that way. But so my point is you don't always have to get it from that because everyone, judges and say, well, I'm not married or I don't have a partner or whatever it is. You can find it in different sources and it
Mhm.
could be in community. It could be in, volunteering for people. The service of gratitude is so powerful to the heart, right? So that's where the heart wants to love and connect. So I love to go off on that. You can read the chapter on that. It's really great. But stress is another one, right? So we get stress all day long thrown at us. The only time that we don't is when we're dead, right? And so the idea is that when you get stress thrown at you, how do you cope with it? What are the mechanisms as to how you end up functioning with stress? And that's where you have to have outlets for yourself, whether it be in the form of meditation or exercise or yoga or breath work or whatever might be the situation. You have to be able to do things to combat with stress. And then
Mm.
the last thing is mindset. When you talk about mindset, it's more about you have to have the right mindset to be able to do that. And so this is where, when we talk about, yes, there's your intelligence is important, but your emotional, we call it EQ, I guess, is very important. Like how you see yourself and how badly do you want to be able to prevent or reverse something, you will. And that then feeds your mind into opening up these neurons to be able to say, okay, I'm looking, I'm finding. Because when you search, you will find on anything, right? You'll find
Right.
people that are able to help you. So that's why I talk about setting the right mindset. And you have to have the belief like we're we're a step, like when we look at our clinics, we have at the HeartFit clinic, our focus is more to, okay, help you with the healthcare system, right? We're not an emergency center. Hey, deal with that when that comes out. And then we're not your cardiologist that you see on a routine basis because it's not that they don't love you either, is that we fall below that in terms of getting to the root as to why you're in that issue or that problem. Right. And so that's the thing that we focus on at the HeartFit Clinic is to get more into that side of things. And you only find that when you're looking for it. If you think that your doctor is going to help you and that's going to be the one to help you, that's fine. You're going to be right. But when you start to understand there are gaps in the healthcare system, and not that the cardiologist doesn't love you, but they're waiting, unfortunately, for, hey, we're going to give you these meds to make sure you don't have a heart attack. But when you do, I'll be there.
Right.
Right. And so most people don't want to wait till that.
Well, it's interesting. I just was reminded Malcolm Gladwell in his book Outliers, he
Yes.
was looking at a particular area in Italy where people were very long lived. And so they researched it and they came to a conclusion. They said, well, A, they grow all their own food, but B, they live in a very hilly area and they have to walk to their fields. So every day they're going out and getting this exercise. Now, they don't even call it exercise. It's just, I'm going to work.
Yeah.
He said, but what he thought was maybe the most important aspect is that along the way to their fields, as they're walking on these hilly paths, they might run into 20 or 30 people that they know in the village, and they'd stop and have heartfelt conversations, real conversation. He said, so you put those things together and you get longevity,
Love it.
right? So it's
Yeah.
kind of exactly what you're saying. The Chinese medicine, there's a pyramid like a inverted, like a food pyramid. But at the bottom is really drug-based medicine. It doesn't mean that's bad. It just
Mhm.
means that's crude, right? You got side effects. And then it's instrument-based medicine where someone is doing something to you. Could be surgery. Acupuncture even is in that category because someone is doing it to you or for you. And then as you go further and further up, it's you taking care of yourself. Like you said, mindfulness, Tai Chi, yoga, whatever that is. And then at the top is really spiritual mindedness. And just below that is family. So you're really talking about the Chinese longevity pyramid.
I love it. That's awesome.
Yeah. And so you've mentioned stents and surgeries. And
Mhm.
is there a time that you think stents are an important part, or do you think
Yeah,
they're
when
outmoded?
you're having a heart attack, I think that's the most important part.
Okay,
Yeah.
that makes sense. And still like coronary artery bypass things, do you see those being done still, or just mostly stents?
I think stents are life-saving when you're actively having a heart attack. The problem is people think that they found a blockage, so they gotta put a stent in, and think about it, it's a metal object going inside an artery that's live, and so there's gotta be a time and place as to when that gets inserted. Same thing with bypass surgery, like, bypass surgery, you're knocked out, they'll crack your chest open, there's ways that they can do it without doing that now, but it
Yeah.
doesn't save lives unless it's an emergency situation. And so
Right.
it depends on the location of it and all that part of it too. So those are important things to look at.
I have a question for you for my own curiosity. I'll see people will bring in coronary calcium scores or any number of things. Mayo Clinic now does some really fun, interesting tests, but you'll see completely clear arteries except in one spot, right? And then one spot, it might be 80% closed, but the other arteries are pretty healthy.
Yeah.
So why would that happen?
It's kind of so there's a lot of shear force that happens to a vessel.
Mhm.
And I also doubt that it's actually clear because you're
Okay.
looking at a two-dimensional artery in a sorry, it's a three-dimensional artery in a two-dimensional image.
Uh-huh. Good point.
So, okay, so let's talk about this because this is an important thing that's, what you're asking is that when you look at a vessel, we're looking at how open that artery is. Well, if the vessel starts to disease, but the opening stays the same, so it's like having construction on the side of the road. It's kind of going, it's not, it's not getting into the traffic, but there's construction on the side of the road. I think a vessel has a lot of construction on the side of the road that you can't see
Gotcha.
in a
Good point.
two-dimensional image,
Thank you. Thank you very much.
right?
um,
Because the artery is a three-dimensional artery, right? Yes, we've got imaging, but now even with imaging, we can go in with cameras and see the vessel wall and see what it looks like all the way through. You're going to start to see a lot of things that are happening. Remember these vessels, there's a lot of things that happen to it. And yes, good things can happen to it, but it's all about what flows into it is a very important thing.
well, I wish you were closer. Um, a couple years ago, end of 2023, I I had atrial flutter, which was fascinating actually because I passed out, went to the emergency room. They did an EKG and all kinds of scans, and it was really busy. Small emergency room, every room taken up. And I saw the PA come up to the doctor with the strip, the EKG strip, and they both looked up at me, and then he shook his head no. So I assumed my EKG was perfect, right? Uh, I get home and I get my records, and I was in atrial flutter 4-1, 288 to 72.
Mhm.
Nobody told me. Nobody said, "Hey," I understand they're busy, right? But someone could have said, "Hey, there's a problem on your EKG strip. You should see a cardiologist," right? Nobody said a word. And so little later, I got a good cardiologist, but he did a catheter ablation and everything seemed great. Next day, I had atelectasis, and developed pneumonia and congestive heart failure. So they did a heroic job of saving me. So first they saved me, then they almost killed me, then they saved me, and then they said, "Okay, after 4 days, you can go home now." And no tests, no recommendations. So of course, I did a bunch of inflammatory testing on myself, and my cardiac CRP, of course, they'd just been in there messing around, but I tracked it over time, and I got no instructions. They did their job. They did a great job, but they just said, "Okay, go home now."
Yeah. And it's tough. Like, I mean, you go to school for years to do a specific narrowing, but you don't go to school to understand all the other stuff. And that's why, you know, I've done a lot of cardiologists that have been in my groups. We've done advanced cardiology modules, we've done fellowships in metabolic medicine. Like that's the stuff that I think every doctor should be doing in med school, but they don't.
Mhm. Right.
Yeah, we got our certifications in that side of things, and that's important to look at. So,
I've found in my practice that the brightest people around nutrition are often medical doctors or PhDs who've really looked into it. But the worst advice I ever see is coming from their GPs often,
mhm.
because they didn't study nutrition, basically. And
Yeah,
so they're just kind of throwing things out there. So my recommendation is to people is always to have a GP. You have to have a doctor. You want to have a relationship, but also have someone else that's not an MD to look at your stuff. Someone like you to do some preventive stuff, or an acupuncturist, naturopath, somebody that's going to be taking a little deeper look on a more of a micro level. Anything else you can get any more words of wisdom, pearls of knowledge?
It's I think it's 3 very important things that we talk about at the HeartFit Clinic and in my books is that it goes beyond cholesterol. It goes beyond stress tests. Like, stress tests are looking like a plumbing problem, it's not that. And heart stents and bypass surgeries are not cures because the artery, yes, it can be life-saving when it's an emergency, but they're not cures. And so that's, I think, the 3 big things I always like to have people walk away with because that's so important to know. And if you've had that or you're trying to prevent it, this is a conversation that you can have at the HeartFit Clinic, and we can go more in depth to see what's happening, and so that we can help people prevent and reverse heart disease.
Awesome. Well, I must admit I have not purchased your books yet, but I will this week for sure. And I want to encourage the listeners to pick those up because, again, these are things that are life saving. Just these basic concepts that Diamond's talking about, very important.
Mhm.
So I want to thank you very much for coming on and sharing your wisdom with us.
My pleasure, and
Thank you.
thank you very much for your time. Yeah.
All righty.
Yeah.
Take care.
All right, take care.
Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.